we've got the AI tool, not just, taking the notes, but also, maybe it's displaying your template, or it's got more of an algorithmic protocol in there of like, oh, don't forget to ask this question, or, hey, did you check this other thing, or this physical exam piece? How long do you think it's going to take until we start getting that level of, not intrusion, but that level of support, I guess you'd call it, on the actual patient encounter side?
Well, it's very exciting because I think it'll make the comprehensiveness of an assessment better. So, you know, as we're primary care clinicians, right? So we definitely think of the breadth. So what's common, also like here's some urgent things, emergent things, not to forget. But there's no way we could remember all the, they call them zebras, right? All the like very rare conditions and their presentations that are maybe very subtle in their initial presentation. But an AI might be able to pick up on it if it has the data to do so. Where this gets a little tricky is like, well, you're asking those clinicians to do more comprehensive history and physical exam that maybe, they're not being overseen at that level right now. And they don't, because of just their practice, they're not asking all those detailed questions. They don't have the bandwidth or the time to get to that level, because of all the patient volume they have to get through. So the constraints of the health system is going to come up against the opportunities that an AI assisted decision support will provide. And it's that, like, how we integrate into the existing workflow. And maybe there'll have to be a complete transformation in the workflow like that. I wouldn't be surprised if, end to end, the continuum of care in 10 years from now is looking very different than it does right now. And 10 years is not that long.
There's already a company in the States. I think they rolled these out in California, but there's like a box, like a meeting room, like you'd see at a communal workspace. And it's just in the middle of a mall. And you go and you sit in it, and the AI like does a whole history taking. And like, I think then it interfaces with a doctor back in the Batcave HQ somewhere. But I think the AI does actually try and tackle the bulk of the patient encounter and the diagnosis. But like you said earlier, having that human layer of redundancy just to like make sure that everything is being done appropriately.
I mean, yeah, I think in the US, they have private healthcare where they push the envelope of what's like actually a good idea in terms of innovation right now. I think a little bit more cautiousness is probably warranted, but it's coming. Some sort of transformation is likely to happen.
So in terms of where you see the direction of Mutuo going, it sounds like you're going to be focusing a lot more on like the task automation, reducing that admin burden. How do you actually get to a point of being effective? Does it require an EMR integration? And then does that really limit you as a company in terms of your growth? Or how do you actually get that to the point of being able to like automate a useful output for creating a consult or a lab rec, or all these follow-up tasks that the doctor would have to do? Or is that even what you guys are planning to do? Did I read you wrong earlier?
Yeah, EMR integrations are really important. We are very much purposefully trying not to become an EMR ourselves. We'd rather integrate with other EMRs rather than get into that competitive space. The sort of added advantage of going with us is that we have a lot of deep expertise and a lot of deep knowledge of how to build these AI models now, how to apply them to these use cases. So we're working well with the EMR vendors that are open to integration with us. There are other EMR vendors that are sort of like walled gardens. They're very closed off. They don't want to integrate with third parties. That's their prerogative. I do think the ones that work with forward-thinking, innovative, nimble startups that are, quickly executing on these use cases are the ones that are going to attract clinicians, over the next few years. The AI-powered EMR is going to be very, very appealing, and it's just how you get to that AI-powered EMR. The EMR is so centered on actually like typing and clicking as a action. But the more and more voice comes into the fray, the more how you design the EMR can change and make it easier. So we're excited to be a partner to those changes as the EMR vendors do those.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.